Patient assessment. You're going to survey the scene for safety. You're going to look for any mechanisms that can impede your patient assessment at this point. You make sure that you have your BSI on. As you approach the scene, you're looking for mechanism of injury. This patient here is laying on the street, and I see a bicycle placed nearby him. And you're also going to assess for a number of victims, which I only see one in this case. Approach your patient, introduce yourself. Hi, my name's Amanda. I'm an EMT. Don't move for me, okay? We're going to check you for any injuries. What's your name?
Pat.
Pat, what happened?
A car crashed into me while I was riding my bike.
Oh, okay. Did you fall down and hit your head at all?
I think I might have.
Okay, do you have a helmet on?
Yes.
Okay. At this time, I'm going to have Tina, a bystander here, come on in and take over for C-spine for me. If you just hold his head real gentle there. All right, Pat, we're going to check you out for any injuries, and I just need you to lay still and answer my questions for me, okay?
Okay.
All right. Do you have any pain anywhere?
My arm hurts.
Your arm hurts. Okay, at this time, while I'm talking to Pat, I'm determining that his airway is open and clear. He's answering all my questions appropriately, so I can also determine that his initial level of consciousness is appropriate. At this time, I also want to assess his breathing, the rate and quality. And he seems to be breathing at about a rate of 20, nice depth and nice quality. And I'm also going to go ahead and determine ventilation instructions. If he had an open chest wound or flail chest, you would address that appropriately, which he doesn't appear to have at this time, and determine if the patient needs any oxygen. He doesn't seem to be hypoventilating, so I don't need to assist in ventilations. And he doesn't appear to have a head injury at this point in time, so I would continue on with my assessment. I would also consider a pulse oximeter, which he doesn't need at this time. You're going to go ahead and check circulation. You want to check your radial pulse. Which arm is it that hurts?
It's my left arm.
Your left arm here, okay. I'm going to check a radial pulse and a carotid pulse at the same time. You're just going to get an idea of the rate and quality. The pulse seems to be about 76, strong and regular. You're also, if you couldn't get a pulse, you could check your capillary refill here. It's normal, less than 2 seconds. You also want to check for any severe bleeding, and you would control that at this time before continuing going on. And you would check for, or consider the need for an AED or an EKG monitor. At that point, you would go ahead and proceed on to your chief complaint and your OPQRST. He's got left arm pain here, so I already know that the onset was about 15 minutes ago before we arrived on scene. Pat, so you're riding your bike and you ran into this car, the car hit you.
Yeah, the car was backing out and it kind of backed right into me and I hit my arm on the trunk.
Okay, but how fast was that car going?
We were both going really slow.
Okay. And quality, what's the quality of pain that you're having in your arm?
It's just like a sharp pain right in the middle of my left bicep area.
Your left, okay, so it's your upper arm here. Does that pain radiate anywhere? Do you have any pain anywhere else in your body, or is it just here in your arm?
No, just the left arm.
Okay, do you have any neck or back pain at this time?
No.
Okay. And the severity on a scale of 1 to 10, could you tell me what the pain is?
It's
With
like
10 being
5.
the worst? 5? Have you ever broken a bone before?
Nope.
Okay. All right, this time you determine if this is a critical load and go situation. This patient seems to be stable, so we'll go ahead and continue our assessment on scene. If the patient were a load and go situation, you would provide cervical precautions, do a log roll, and check the back and finish your assessment en route. You want to keep your on-scene time less than 10 minutes, and you would also contact your base hospital and let them know that you're en route with a trauma patient. And you would also determine if your patient meets policy 506 or 808, which is mandatory base station contact or trauma triage. At this point in your assessment, you're going to determine your level of consciousness. I've already asked him if he's been knocked out at any time or lost consciousness. I already know that his name is Pat, so you could ask your patient his last name. Pat, what's your last name?
Long.
Pat Long, okay. Do you know where you're at right now?
I'm at Albertsons.
Okay. And do you know what day of the week it is?
Sunday.
Be careful with asking your time question. A lot of patients don't know what time it is, so you want to ask them a relevant question as to what day or what month, who the president is for an elderly patient, something that orients them to the time. Okay, so at this point, you determine your Glasgow Coma Scale number. At this point, he seems to be a 465 to me, so he would receive a 15 on the Glasgow Coma Scale. Before going on with your secondary exam, you need to get your consent from your patient. Pat, I'm going to go ahead and do a further exam. I need to go ahead and palpate certain regions of your body to make sure there's no further injuries. Is that okay with you?
Okay.
Okay. You're going to palpate the head, starting from the back. And you're going to start gently and then a little bit firmer. You're checking for DCAP BTLS, which stands for deformities, contusions, abrasions, punctures, penetrations, swelling, tenderness, laceration, and burns. You also want to check for any blood on your gloves once you remove them from the back of the head. Palpate the face, feeling for any bone fractures here. Check the jaw. Okay, you want to check behind the ears here. And behind the other ear here. Make sure that you're not turning your patient's head at any time. You also want to check inside the ear, inside the nose. And can you open your mouth for me? Very good. You're checking for any loose teeth, blood, dentures that may have come loose. And if it's dark, make sure that you're using a pen light to increase your visibility. Okay, then you're going to go ahead and check the pupils. You want to make sure that you shade the eyes from any light. You're going to come in from this side, and you're checking this eye. Again from this side. And once more. Okay, pupils are equal and reactive. And you also would want to note if you arrived on scene and your patient was already intubated, note the placement of the ET tube. You're going to go continue on. I'm going to get my partner here to get some vitals for me. If you could get a blood pressure, respirations, and a pulse. And his left arm here is injured, so the right arm would be perfect for me. While she's doing that, I'm going to continue on, and I'm going to palpate the back of the neck and the spine. Checking for DCAP BTLS again. I want to note any tracheal deviation, any trauma to the neck, or any JVD. And at this point, I'm going to, when you're finished with those vital signs, if you guys could go ahead and place that C collar on for me. You also want to note any stoma or med alert tags. Go ahead and fill behind the whole neck to make sure there's no necklace there. And check the wrists for med alert tags as well. Okay, you would proceed down to the chest. You're going to palpate the chest, checking for DCAP, BLS, and TIC. Okay, chest wall's stable. And the extra P in this one is paradoxical movement. If I could borrow those for you.
Sorry, that was it.
All right, I'm going to go ahead and check your lung sounds. If you could take a deep breath for me. Again. Again. And last time. Okay, his lungs sound equal and clear. All right, at this point you move down to the abdomen. You're going to palpate starting with the right upper quadrant. You're looking at the face for any grimace, and you're feeling for tenderness, rigidity. Okay. After the abdomen, you move down to the pelvis. You press in here and down on the pelvis. And you're feeling for tenderness, instability, or crepitus. In an unconscious patient, you would want to note if there were priapism, incontinence, and go ahead and move on from there to the lower extremities. And palpate, feeling for DCAP, BTLS. Make sure you check the patella. And palpate both legs. Okay, you're going to check for pitting edema on the ankles. Make sure you check both legs. You're going to check sensory, motor, and circulation. Can you feel this?
Yes.
Can you feel this, Pat?
Yes, I do.
This?
Yes.
And this?
Yes, I do.
Can you wiggle your toes for me? Very good. You can check your posterior tibial pulses. Okay, or you could also check your dorsal pedals, and if you can do that, you could check your capillary refill and take the shoes off. And move back up to the upper extremities. I'm going to palpate his clavicles here. And you're palpating using comparative anatomy. Feeling for any tenderness, instability, or crepitus. Palpate the shoulders. And you're going to go to your upper extremities here. Palpating again, feeling for DCAP, BTLS. Make sure you palpate the elbow. You want to also note any track marks, tattoos, anything of that nature. Can you feel this, Pat?
Yes.
Can you feel this?
Yes.
Can you wiggle your fingers? Good. Go ahead and check a pulse. You want to actually check matched pulses. And in this case, I'm going to go ahead and check matched ulnar pulses as well. And if you couldn't do so, you could check your capillary refill again. And since his arm is injured on that side, I'm not going to check range of motion, but on this arm, I'm going to have you reach up and grab my fingers. Good. Can you squeeze those for me? Can you squeeze these fingers? Both at the same time? Good. And that's checking your range of motion. And I'm going to go back over to his left side and assess his injured limb. You want to visualize your injury and, as necessary, palpate. I'm going to go ahead and push your shirt up a little. Okay, so you'd visualize your injury, again, palpating as you did on the other arm. Does this hurt when I palpate your arm?
A little bit, or it hurts there.
Okay, can you feel this?
Yes.
Can you feel this?
Yes.
Can you wiggle your fingers? Okay, and at this time I'd instruct my other partner to splint his injured arm. And once that's done, we would prepare for a log roll, and I'm going to check his back. So now that the arm is splinted and the board's been placed, we're going to perform a log roll. So if you could control his neck here, and you're going to control his legs, one hand here and one on the hips. And I'm going to control the injured limb and the upper torso. And Pat, we're going to go ahead and roll you towards me and place you on a board to transport you, all right?
Okay.
On my count, we'll roll towards me. 1, 2, and 3. Okay, this time I'm going to go ahead and check the back. I'm going to palpate again down the spine. Checking for decap, BTLS. Feeling for any tenderness, instability, or crepitus. I'm going to auscultate lung sounds again. Take a deep breath. Deep breath again. Again. And one more. Good. We could pull the board in. Good. And we're going to roll them back down on 3. Ready? 1, 2, and 3. Okay, good. And I'm just pushing. There we go. At this point, while my bystanders would secure him to the board, I'd finish up my assessment with my ample questions. Pat, are you allergic to any medications?
Penicillin.
Penicillin. Do you take any medications?
No.
Do you have any medical problems?
No.
When was the last time you saw your physician?
I don't know.
You don't remember?
No. I haven't gone to a doctor for anything.
For a couple years, okay. And when was your last meal?
This morning.
And then just to wrap up the events leading to the injury, you were riding your bike, car was backing out, you hit it at a low speed, you fell off, hit your head, and you have the left upper extremity pain, correct?
Yeah.
All right.
Just my arm.
Okay, good. At this point, we'd load our patient up and prepare for transport. You would determine another Glasgow Coma Scale number. You also would treat for shock, elevate the legs, prevent heat loss, avoid rough handling. Monitor vitals, give O2, and you want to report off and prepare your report to give to your nurse as soon as you enter the emergency room.